Welcome to the Manifesting Health series. I'm Curry Bordelon, your host for this discussion. The Manifesting Health series provides engaging interviews with experts in men's health. Today, we're excited to have Michael Frazier join us for this episode, Beyond the Battlefield, Veteran Health and Wellness. Michael Frazier is an experienced nurse, educator, and retired US Army Reserve Colonel with over 4 decades of expertise in clinical nursing, cardiac care, and nursing education. He has served in diverse roles from bedside care to leadership in military medical operations, including Persian Gulf War. Passionate about teaching, he continues to contribute to the profession through education, research, and advocacy for men in nursing. Welcome, Michael, and thank you for your service.
Okay. Thank you. Like you said, my name is Michael Frazier. I'm originally from Oklahoma City. I graduated a licensed practical nursing school in 1975 and University of Central Oklahoma. It was called Central State University in 1982. Went on to get my master's at Duke University and my doctoral at Liberty University. About a year after I graduated from college, I was pulled aside by one of our nurse supervisors who had served in Vietnam and coached me. You might be a good fit for the military. I went served at Fort Sam Houston, Texas, and at Fort Riley, Kansas. I got out in 1986 and joined the Army Reserve in 1986 and 87. 1991, as before mentioned, I served in the Persian Gulf War. Also taught EMT and for the 5th Brigade of the 108th Division. I also served at what is now known as Fort Liberty. It was at Fort Bragg at the time with the 3274th U.S. Army Hospital and the backfilled Womack Army Medical Center. Currently, I work for Duke Regional Hospital on the telemetry unit. I also teach at Watts College of Nursing. So one of the things I could go ahead and
No,
discuss.
this is great. Yeah,
Uh,
I appreciate you giving us a broad overview of your career, and it's an expansive career in many different environments. So we really appreciate that. One of the things we really like to focus on during this the Manifesting Health series is not only the expertise of all of our speakers. So I really appreciate your time. I want to talk a little bit about where we are in veterans health. What's sort of the state of veterans health here in the U.S.?
well, I'm not an expert in veterans health per se. We do have a veterans medical center here in Durham, North Carolina. But one of the things I'm really concerned about is two things in particular is suicide rate. Some people, there's a one uh, organization called Stop Soldier Suicide, which estimates there's 17 to 22 uh, service members take their own lives every day. There's a t-shirt company that puts out a 22, has the number 22 on it. I have one of those t-shirts. 22 soldiers take their lives every day. And the amount of homelessness among veterans. We see homelessness among veterans here in Durham and Raleigh, in the Raleigh-Durham area. I'm originally from Oklahoma City, and you will see them in Oklahoma City. Um, uh, it's just that they seem not to fit into society anymore. I had discussed this with one of the leaders from Stop Soldier Suicide. It seems like you're not in your tribe anymore. One of his concerns is they put a lot of emphasis on preparing you how to be a soldier, going to basic training, teaching you. But when it's time to get out, it's a 1 or 2 days to adjust from military life to civilian life. I don't consider myself a civilian. I consider myself a veteran. Even though I've been out for 12 years now. I retired from what was Fort Bragg about this time in 2013. But I don't relate. I don't say that. I say I'm a veteran. I'm not a civilian. So, you know,
Yeah, what other that's it. So glad you brought forward the suicide because, mental health and wellness within all populations and more so in the veteran population is extremely important to include as we're caring for the whole patient, as we're caring for the whole individual, inpatient and outpatient for that matter. So, in your clinical practice, in your education, in your spaces where you are, what are some of the other gaps that we're finding in veterans care?
Well, one of the things I am concerned about also is the level of access. There is a retired Army nurse who teaches at UNC nearby at Chapel Hill, General Wilmoth, who was a two-star general Army nurse. And we exchange emails in prepared for this presentation. And one of the things is just getting access to care.
Mhm.
Sometimes the bureaucracy is difficult to overcome. Like they were wanting to have yoga for veterans at the VA, and I couldn't go because I don't get my care from the VA. I get it from Duke University Health Systems, and I was going to help teach, learn how to teach. It's no, we can't have you because of this rule they have. But I think it's getting access to care. Um, Another thing I'm concerned about is maybe there's a bit of a shame to it. It's like people don't like I'm fine, and then like a denial of I'm okay, but um, I don't want people to know about these things. And sometimes I think it's just how I say I'm trying to think of the term or an example like for mental illness. Like in preparing for this presentation, there was a commanding general at Fort Bliss, Texas, who had some depression issues. One of the things he wanted, there was a high rate of suicide at Fort Bliss. This is in West Texas. And he looked to himself and said he didn't want to admit he had a problem because he might get passed over for promotion. What would people think of me? I might lose my job if I say I'm depressed or I'm having problems with this. And he wrote about that later after he had developed a program for Fort Bliss. Um, and so don't be afraid, don't be ashamed. Come on in and get and seek help. And after he had left Fort Bliss, the suicide levels went back up to their original after he had left serving at Fort Bliss.
Your example is really important because it highlights two of the things that we really want to make front and center during our conversations. Not only veterans health, obviously veterans wellness and health and so forth is incredibly important. We're taking care of all individuals in the U.S., specifically those who take care of us, if you will. And so the veterans piece of that stigma of I have been trained to take care of the issue. I've been trained. It's not an issue. Let's move forward. Let's like work past it. But also your example included a male. And so on top of that is already the challenges of a male patient that we commonly address, which is that stigma. So there's stigmas with healthcare in general. Mental health is even exponentially higher, but also a male patient who frequently does not achieve the same health rates as other populations and gender. But at the same time, now a male soldier, a male veteran, a male military also is a challenge that compounds that effort in an unfortunate way. What do you think are some opportunities for us within practice, within military life? Where do you think are some opportunities to help break that down and erode that stigma in a way that's positive for our patients?
Well, one of the things that happened to us, we were in Saudi Arabia, and we were about to come home. And the chaplain, we were in a hospital tent. We had taken all out of the furniture, put it away. He had us all sit down on the floor, and he talked about, look, you're going home to your wives, you're going home to your husbands, you're going home to your families. Their lives have gone on since you've been here. And we were in Saudi Arabia from January to June during the Gulf War, and their lives have gone on. They've paid the bills, they walked the dog, they took care of things, and you're going to go back. Be aware of that. Okay. Also, yeah, I know you're anxious to go home. I know you want to go home, and you think if you tell me that there's something wrong with me, we might keep you on active duty, not let you go home. And see, please don't do that. And just say, look, you need care. I know you want to go home, and take away the stigma. And I think it's a stigma generally, it's general. It's a general stigma. Like, minute we're supposed to be tough, we're supposed to be able to handle things. we're supposed to be brave, nothing could get to us, and then, but that's not true. I mean, I have issues. I'm like anybody else. I'm a human. I'm a human being. If somebody gets upset, I get upset or I get frustrated, just like the next man or woman. And that's part of being life. That's part of life, and being able to accept that. Um, just break down that barrier. It's okay to like I saw a football. It was a football player. It's okay not to be okay. Like some of the football players are trying to, not NFL. We're coming up on the Super Bowl here, and it's okay not to be okay. You need to say something to somebody, and we need to be able to provide. Oh, you're just being a wuss or something like that. No, okay. Let's sit down and talk about it. If you need medication, we'll see what medication you need. If you need counseling, if you need group therapy, uh, there's a thing about I mentioned in my emails to you about Veterans Yoga Project. Yoga's for girls. No, there was a story about a sniper in Vietnam. He came home, he couldn't sleep, and he went on for a long time. They tried everything. They tried psychotherapy, medication. So he said, "Well, what do you got to lose? Let's do the yoga." And at the end of the yoga practice, if you know anything about yoga, there's a thing called they call it the shavasana. It's the corpse pose. They didn't call it that because it reminded people of death. It was just a resting pose. He fell asleep. And he slept for 6 hours. It was the first time he'd slept that long in years, and he felt rested. So it works. It sounds silly, and if it works, it's not silly. Also, there's a joke, and you probably heard this joke. All us men we're all Egyptian because we live in denial. And like we don't. Oh, I'm okay. My prostate's okay. I don't have to give up cigarettes. I can take it. I can do this, and then, well, you're not okay. Trying to erase the stigma. It's going to take a lot of effort to overcome the stigma of you need help. It's okay to ask
Right.
for help.
Right. And again, I'm so glad you're mentioning that because that's where we're trying to do is, every time we're having the conversation, we're breaking down that stigma a little bit by little bit. And I really appreciate your stories and your feedback on that because it's so true that we deflect because in the basal part, in the part of our brain that is who we are, we we want to instinctually go to I'm invincible. I can take care of that. I don't need help with that. But in actuality, the human body's reaching out. So thank you again for your time. As we finish up, in our last couple seconds together, do you have any big takeaway message for any of our listeners?
Well, I think just public awareness of, I know there's a lot of people we want to make aware of this and that, but there is a problem, between 17 and 22 service members take their lives every day. There's a place that I mentioned, Stop Suicide, Stop Soldier Suicide. There's some of the t-shirt companies like Till Valhalla and a couple of others being aware that this is going on, reaching out to the service members. We're not fighting as much. We do have military operations going on, and one of my students is going to be going to Kuwait here probably this summer with the North Carolina National Guard. We are deploying soldiers and sailors, throughout the world, trying to keep the peace. Um, I don't know what, and maybe not to make it a political statement. Also, probably find out why are we having so many veterans or homeless. That's an ongoing
Right.
for a very long time, and maybe work with the Veterans Administration, the Department of Defense, and find out if we can have better access to care through the Veterans Administration.
Okay, excellent. Thank you again for your time. We really appreciate it. And thank you all for joining us. We'll see you next time.